So the email, if you want to just send it right here, is Senate 450 cap, CAP, at Gmail. We are going live now. Give it like 2 minutes. Senate 450 cap at Gmail. Yep, that looks right.
Is he sending over the PowerPoint file?
Yeah.
Howdy, howdy. Can you try send when you get done with that? Can you try sending that to me? Please. Hey Fred, how's it going?
Forward. For being here today for the combined committee of the Senate Study Committee on Artificial Intelligence, as well as the House Subcommittee on AI. As you can see, we're working together throughout this time. We're grateful for everyone's support. We know it's been a busy season, and we thank you for being here today. We're going to begin our meetings, as we always do, with a blessing, and Senator Setzler will do so for us.
Thank you, Mr. Chairman. Pray with me, please. Dear Heavenly Father, we love you so much. Lord God, you're the giver of all good things. I just pray, Lord God, that we would be wise, that we would be quick to listen and slow to speak. And Lord God, we would seek to glorify you in all that we do. Give us wisdom beyond our own faculties, that we would glorify you in all that we do. And that, Lord God, we would come together as a group of people and have collective wisdom to move your state forward, or this state forward, Lord God, in a way that will glorify you. We pray this in your holy name. Amen.
Amen. Thank you. I'm going to do a couple opening comments here and then pass it over to my counterpart for the House Chairman, Thomas. Thank you for everybody understanding we had to make a little last minute move with some logistics to make sure we had a big enough meeting room. I want to thank Emory, though, for all the work that you all did, Sydney and Veronica. We appreciate all the moving around, and specifically also Mr. Will Spencer next to me here, who quarterbacks and makes all this stuff happen, which I know you'll all have heard from on many occasions. This is the final committee meeting prior to us getting a report together. So while we'll have a final meeting on the 3rd of December for the Senate, this is the last chance we'll be absorbing content. You have all gotten an email from Ms. Haley Williams over here at the end, who leads our Office of Policy and Legislative Analysis. And she needs that information from you as soon as possible. And what we'll do is we'll continue to update as we find recommendations and still send them back out to everybody as we can get them together. The goal will be is the week before the meeting, the final meeting on the 3rd, is we will have a draft report out to all the Senate committee members. I know the House has got a separate process. So everybody can be able to read through those thoroughly, make sure we're good to go, because on that 3rd meeting, we will officially adopt that report and recommendations for what we learned and what we think we're going to go forward. Knowing that artificial intelligence is changing literally on a daily basis, this is not the end. It is not even the beginning of the end, as Winston Churchill said. We have a lot of work ahead of us. So with that being said, I'm going to turn it over to my counterpart, Chairman Thomas.
Thank you, Chairman Albers, for my friends here on the House Committee. Obviously, this is our last meeting, as that will be meeting joint. We will have a virtual meeting that would like to discuss. Well, we'll go over the details of our report. I would ask that everybody that's joined online and here in the room, if you have any comments, things that you'd like to have incorporated in the report, if you could try and get me something in the next 2 weeks, that would be very helpful. So with that, that's all I have.
Thank you, Chairman Thomas. And a reminder, we do have a website set up. If you go to study committees on the Legislative General Assembly's website, you will see it there. There's also a contact form. It would be impossible for us to hear from every single Georgian. However, there is a process in place that every single Georgian can contact us, though. We want to hear from you if you want to send that in writing, if you want to send that in form of other media, you want to send us presentations. We are happy to see that. We will review all of that information because we want to hear from each and every one of you. Quick reminder, we put together at the very first meeting what we call our AI Study Committee framework. If you remember that is also on our website, and it really broke it down to different areas. And just a reminder, and also for our speakers here today, is we're looking at things specifically labor and workforce, research and development, public safety and healthcare are 2 topics for today, transportation and infrastructure, education, economic impact and innovation, those being the verticals. And then the horizontals that cross all those lines are regulation and ethics, privacy and data protection, social welfare, and equity. So this has been kind of the base of how we have constructed the work we've had today and what we've heard back from. And we're very excited again today to hear specifically about healthcare and public safety, which are dynamically tied together. We have some great speakers and presenters, and we're going to begin at this time with Emory University Healthcare. Dr. I'm going to say this right. Is it Erskine. Okay. Why don't you come up to the podium, make sure you have everything you need. And I'm going to take a quick moment to brag on Emory. Emory, 3 years and a few months ago, saved my son's life by me giving him a kidney. And 5:00 a.m. on July 21st, 2021, we walked arm in arm into Emory Hospital University. And he is healthy and he is happy and he's in great shape because of the amazing team at Emory Hospital who saved his life. And I'm forever in your debt and grateful. Thank you.
Hello, everybody. My name is Alistair Erskine. I'm an internal medicine and pediatric physician. I'm also the CIO for Emory Healthcare and Emory University. And Chairman Albers and Chairman Thomas, thank you. And representatives and senators, thank you for giving us an opportunity to address this topic, a really important topic. What I plan to do in this short 15 minutes, which probably won't give justice to the enormity of the topic that we're discussing, is to describe a little bit about what we are doing today when it comes to the application of AI at the point of care and in healthcare, and what we're doing today also when it comes to higher education at Emory. and then offer some challenges that exist in that space. So the first thing is thinking about the patient experience. So we kind of think about technology in 4 dimensions. What's the experience I want to change for the patient, for the care team, for the researchers, and for faculty and staff? And so we have a series of programs for the patient, one of which is a digital front door. And part of that digital front door, which gives us the ability to present to the patient, the portal and wayfinding and so forth. It includes something called conversational AI. And conversational AI is the ability for a patient 24/7 to just be able to ask questions of the system as opposed to a specific individual that's answering those questions. And that patient can book an appointment, can get steerage if they have symptoms and they want to get themselves triaged to figure out where to go. It is a breakthrough opportunity since it is something which is available to patients all the time. When it comes to the clinician experience, we have now live 2,000 clinicians that are using something called ambient listening. Now, ambient listening, if you don't know, is a technology that obviates the need for a clinician to write a clinical note from scratch during every outpatient visit. Doctor walks into the room, asks permission of the patient if it's okay to record the session, then puts down their iPhone and then has a conversation with the patient, ignoring the computer, the keyboard, the mouse, is able to pay attention to what's going on in the visit. Everything is being captured. That is converted into a transcript, which is then converted within 1 to 2 minutes into a clinical note. And that clinical note ends up in the chart immediately. So there's no bias in terms of recalling what happened in that visit. If you're seeing 60 patients a day, which happens with some of our urologists and orthopedic doctors, you can imagine the cognitive load associated with trying to remember who's doing what. And this does this automatically. It also helps figure out what's the right set of content. So in the future, what you'll see with these kinds of ambient technologies is assistance with differential diagnosis, assistance with the right kind of treatment when it comes to assessment and plan. And it does another interesting thing, which avoids a situation where there's a lot of copy and paste in medicine, right? So you kind of get something that was done before, you paste it into today's visit. The benefit of ambient listening is you're actually capturing and documenting what happened in that office. The next place this is going to go is on the emergency department and inpatient units. In fact, we're working right now with our emergency department physicians and using this today. The inpatient unit is a bit more complicated because you now have maybe 5 or 6 people in the room talking with a patient, and the system needs to understand who's saying what and which note is it supposed to land in. The next after that is nurses. We have, as you know, a major nursing shortage, and that gets better when you don't, no nurse really went to nursing school to hug up to their flow sheet on the computer. And if there's a way for the nurse to be able to talk to his or her patient and then have that automatically complete the flow sheet, that can be beneficial. Now, moving on from ambient listening to ambient video, we have installed these cameras in the patient's rooms. And what these cameras do are one of 2 things. One, they automatically using something called LiDAR, which is something which just shows the shape of the patient. There's nothing identifiable. 24/7, it's on and it looks to see if the patient has a propensity to fall out of bed. So before they fall out of bed, 45 seconds, in fact, before they fall out of bed, the alarm goes off and tells the patient, stay in bed, somebody will come and help you. If the patient doesn't, then it sends out an alarm to the unit to go rescue the patient before they fall. Now, fall is a major problem in a hospital. You can imagine you have patients that are sick. They may have anesthesia. They may get confused. They may have a catheter and they feel like they need to go to the bathroom, all those kinds of things. So doing something like this to prevent falls and also to prevent pressure ulcers. Somebody who's sedated, who lays in bed, who's not being turned every 2 hours, the system can tell that the patient hasn't moved and therefore alert the nurse to do that. So those are the automated ways that this AI ambient video helps. But of course, by having a video in the acute room, you can do all kinds of other things like virtual nursing, virtual sitters, virtual family visits, virtual medical interpretation, virtual consults with other clinicians in different parts of the hospital or even the system. So really interesting technology. This is also the next thing is that will manifest is an OR black box. So looking at the OR procedure, making sure that timeout occurred, making sure that the sponges that went in the patient are equal to the sponges that came out of the patient. This is where this ambient video technology is going. So beyond that, I described a couple of kind of clinical applications, but as you can imagine, we're using AI for any number of different things, predicting if a patient is developing sepsis, or even helping with administrative functions like making sure that the claim that goes out to the insurance company is accurate, that we, in fact, one could even argue that as we build our bots, our robotic process automation to make sure the claim is correct, the health plan companies that build in their bots to make sure that they can review those, and there's a bit of the battle of the bots going on. And then on the university side, you can imagine that the same kinds of technologies are being applied for students and for faculty in terms of helping out what they're doing. So this is just a bit of an eye chart. My apologies, but it's a way of kind of looking at the fact that AI is not something that we can put back in the bottle. At this point, in every dimension, whether it's education, operations, clinical, or research, we're making heavy use of this. The other challenge that we have is in terms of how to govern this, because like the chairman said, this is something that changes on a daily basis, maybe even an hourly basis. And so therefore, there's a plethora of clever entrepreneurs available who are willing to come with their application and try to convince us that it's the right next thing to get. At the same time, we have to make sure we understand what the consequences are of applying these kinds of technologies around. So one that I haven't described in detail is kind of the next iteration of AI, which is the generative AI technology. So we use something called large language models. So this is, as you probably benefited from using sort of ChatGPT and those kinds of technologies. There are a number of them now available. And we're able to then tune these models with something called retrieval augmented generation, or RAG, to be able to better understand which patient is eligible for an Alzheimer's drug, or which patient is best suited for the top 3 clinical trials that they should be offered, or how do I fill out a registry of cancer patients? If you look at registries for cancer, for example, there are 1 to 2 years behind typically across the nation because of the amount of time it takes to actually take all the information out of the electronic health record and upload it into the registry. With these LLM tools, I can do that in a much quicker and actually more accurate fashion. So these are aids for these kinds of things. This is just a couple of examples. We have a series of policies, thousands of policies that a nurse is supposed to be able to run around knowing what they are. Actually, 47% of the time, they give an inaccurate answer when asked about a policy, and they oftentimes skip the lookup process because it's too difficult to do. So we created this large language model that makes it really easy to interact with all of our policies at the same time by just having an English backwards and forwards interaction, making it a lot faster and a lot safer. Same when it comes to our infection preventionists. So these are the nurses that are looking to reduce infections of various different lines that the patient has to endure, and being able to look through the chart to identify where there was a problem and which infection it was takes a lot of time. By using these large language models, we're able to save a ton of time. So I'm just trying to make a case for the fact that we have an opportunity to reduce the clinical burden and the administrative burden with these kinds of tools. Now, Imagen is probably one of the earliest uses of machine learning and deep machine learning. So this is where you can absorb a CAT scan, and the system will tell you if it detects a stroke. And it won't uniquely diagnose the patient with a stroke. What it will do is it will take that study and put it at the top of the list of studies that the radiologist is supposed to read. And what that does is, in a case where somebody is a bit weak and dizzy on a Friday afternoon in the ambulatory clinic and you get a CAT scan, usually that CAT scan is read on the following Tuesday because it's non-urgent. But with this technology, it's automatically, as soon as it's run off the CT scanner, it's put through the system. And if it detects the fact that actually there is a stroke, it will alert the radiologist right away, not waiting until the following Tuesday, and therefore being able to intervene within that window to be able to get rid of that clot. So some really interesting and useful ways that we can use this kind of technology to be able to detect stroke, to be able to detect intracranial hemorrhage, and even pulmonary embolism. We run this technology across patients that have cancer and found, in this case, a significant number of underreported pulmonary emboli, which obviously changed the treatment. So I bring all this up with knowing that there are some significant challenges in terms of the infrastructure that's required to be able to support all this clever technology, the data governance in terms of the ethics and prioritization. I'll give you one anecdote where a clever OBGYN doctor had come up with a way to clone his voice and video and created a very useful video of what to do and what to expect if you're pregnant during your pregnancy. And that actually went to our responsible AI committee. And we liked the entrepreneurial aspect of it, but we were worried about the fact that this was an AI-generated video, and therefore decided that we would want to make sure that we disclose to the patient that this is produced by AI if we were going to use something like this, because we want to make sure that we protect and take care of the trust that we have with our patients and don't trick them into thinking one thing versus another. We also are working closely with the FDA to understand the validation, ongoing monitoring of these. When you put this kind of AI into action, it can drift with time, and you need a way to be able to continue to surveil it. So I'll stop there and see if there are any questions. Thank you for your time and attention.
Wow, that was fantastic. It's so exciting to see how this is going to make such a difference in people's patient care and lives moving forward. Couple of quick questions to start out before I get to the committee. You know, the LiDAR cameras and the surgical analysis of how many sponges went in, et cetera. Is that being used currently, or is that coming?
So the LiDAR technology is being used currently, and I'll say we're not the only hospital in Atlanta to do so. The OR black box technology is being developed, so that's not actually live yet.
That's great. And one other question, you know, we've been trying to get everybody to more practically use electronic health records for 20 years now. You know, we always talk about HIPAA and people think about the protection, but it was the portability part that was probably even more important at the time. How is AI going to be utilized in order to make sure we can, you know, have people's medical records accessed immediately and be able to use that in order to have, you know, more specific and accurate diagnosis?
So one of the challenges with interoperability is that it's a little bit like the Tower of Babel. Everybody's speaking a slightly different language when it comes to the information that's communicated along the pipes. We have health information exchange. We have different electronic health record systems. They all organize data slightly differently. They call things differently, blood sugar versus blood glucose versus other things. So what AI can do in a situation like that is help develop a semantic and syntactic interoperable layer and summarize chart with all this disparate information and be able to make it much faster to consume. Because it's really, when you consume an interoperable piece of document, there are really two ways that it comes in. Either it comes in as a PDF where you have to go through and read through the PDF, or it comes in as discrete elements of the medical record, which files automatically into the problem list or the allergy list or the medication list. The latter is better, but that requires a lot of wrangling of the data. And what AI could do is actually, as it comes in on a PDF, parse out the parts of that PDF that actually belong in the dynamic aspects of the record and be able to pull those in. So that's one example.
That's great. Questions from the committee members? Senator Still.
Thank you, Mr. Chairman. Dr. Erskine, thank you for being here. Couple of questions. So I'm not trying to lead you down anything. I'm just trying to understand. As I look at this, how much of this is proprietary to Emory versus like open source, open market with that?
Yeah, so a lot of even the vendors that sell their technology are using mostly open source technologies. Now, I would say even in the large language models that we have developed, they would be our intellectual property, but we're pulling from large language models that are publicly available. But the kind of the workflow analysis, the tuning of it, making sure that it's not what's referred to as hallucinating, which is basically making up information when it doesn't have all the information necessary. That aspect of the tuning is proprietary, how it insinuates into the workflow. But a lot of what's out there is open source, and we primarily consume vendor products. So whether it's our electronic health record, Epic, or whether it's ambient listening tool, Bridge, or VirtuSense for the AI cameras, and they're the ones that are actually pulling from both open source and proprietary information and selling that and licensing that software.
So I guess just in a very high level, you kind of touched on 3 areas of healthcare delivery in here. I know there are a lot more, but cardiology, radiology, home care. So much of that could be supplemented. I don't want to say replaced by AI, but certainly deeply supplemented. And then I think about rural healthcare, where we don't have maybe a cardiologist or a radiologist, and it takes a week to get back an MRI result. How much of this can be utilized and deployed in rural areas that don't have the Emory technology or connection to Emory to be able to help us prop up our rural health system to be able to use some of this to fill in the gaps where they don't have physicians to do those things?
So, Senator Still, that's a great question, because it actually is a question which is debated around where are we with equity when it comes to AI? What if there's bias that's introduced into the algorithms? And what if, we're favoring, one demographic over another? That has to be put into context of exactly what you're describing, which what about scaling some of this technology that would otherwise not be available to any of the folks in the rural communities? And the marginal cost of scaling data and technology is significantly less, and obviously having to hire people and have to move to those areas, and even having the virtual capabilities. If I'm able to insert into a system that's in a rural hospital the sepsis algorithms and the way to be able to your point, augment, not replace, but augment a diagnosis, I've now basically taken super subspecialized intelligence and moved it out to the broad population to be able to consume. This manifests itself with us when it comes to digital pathology. We take the slides, and instead of putting them under a microscope, we take the slides and put them in a very special scanner that scans 100 different levels of that slide. And then we can use that to create AI for digital pathology. Now, what that means now is I don't need that super specialized digital pathologist in rural Georgia. All I need is that slide. And in fact, we're even considering using drones to be able to capture that slide and then read it, process it, and send that information back to the rural community. So we're doing everything we can think of to try to expand and push the knowledge that's generated at Emory much more broadly. Thank you.
Other questions? Senator Setzler.
Thank you. Appreciate you being with us today, Dr. Erskine. I'm going to ask a question, maybe a little bit uncomfortable, but I think it's something that we want to wrestle with. I mean, how can we assure as technology progresses and becomes more the status quo, that people who have a diversity of opinion with respect to how they interact with technology have their diversity recognized? I mean, diversity manifests itself in opinion, geography, income, ethnicity. I mean, diversity manifests itself in many ways. And if a person, I think this past weekend, I went to one of my high schools was in the state volleyball championship. And there was no way to get to the volleyball championship into the arena and watch the game from one of my teams without downloading an app and paying online and scanning my ticket on my phone. No, I'm fine with that. I use technology, but if I didn't want to engage with an iPhone, there was literally no way to get into a state volleyball championship. I say that moving forward 25 years from now. If there's somebody that says, I don't want to talk to my doctor with something listening to me. I don't want to be videotaped in a room. As healthcare progresses to a place where the staffing levels, the assumptions, I mean, the praxis of medicine in a hospital setting becomes dependent on having these kind of AI models watching somebody in a room, are people going to really truly have the ability to say, I don't want that. I don't want to be monitored. I don't want to have this looking at me. I don't want to have an audio recording of my delicate conversation with my doctor, because I know it's quote HIPAA protected. I want no one to know what was said between me and my doctor. 20 years from now, how can we protect the sentiment, the diversity of opinion that says, I don't want to be any part of that?
So you're right. That is a controversial topic, because as the status quo becomes kind of, well, the way we practice is with all this technology, all this data, all this AI, all this digital, we can't expect that every Georgian is endowed with an iPhone. In fact, so a couple of ways I can answer your question directly. We require from our vendors that we are able to turn this off on demand. So the cameras, for example, there are two different things. One, the LiDAR piece is unrecognizable. There's nothing identifiable that's picked up in terms of being able to keep track of whether they're going to fall out of bed. When the video camera turns on, there's a 45-second lag to say, we're doing a digital knock on that door. Are you okay with that coming in? Maybe the patient's not ready. Maybe the nurse is doing a procedure and can say no. But in addition to that, when the patient's admitted, there's an opportunity to say, I don't want any of this. I don't care. Even if it's going to help me. And we just turn that off. Same thing is the consent that is obtained for the ambient listening in the clinic always starts with the same, is it okay if I record you to help you know? And the answer is no. I mean, the answer is, we can just not use it in that case. The third thing is, in any technology that we deploy to patients, we're constantly looking for an alternative to avoid the situation where we think that people are endowed with a smartphone, because all the vendors come up with some fancy looking smartphone and, all the great things that work in it. To your point, it now requires people to have that technology to be able to work. So we will put something on the portal. You just saw me, describe the fancy kind of MyEmery app, but then we'll also have a two-way texting option as a backup for people who have a flip phone and don't have them.
And I don't want my analogy to miss the point. It's not about individuals having to have technology. It's about individuals who want to check out of technology.
Yeah.
I mean, there are families in the state who go to doctors specifically because they can private pay. They can have a consultation. There's not going to be public medical records that's shared up to people, because the power to read someone's medical history is the power. It goes in all kinds of directions, especially in a mental health context. So I'm asking the question really more about 2040 and beyond. When this becomes the standard, it becomes commonplace. How do we as policymakers put something in place that you get real consent? That's not just initial these blocks. And secondly, how do we maintain the sensibility for someone to say, I don't want any part of any of this. My life is in jeopardy. I need to see a doctor. I'm in a critical care circumstance or an acute care circumstance, but I don't want AI part of this. I want to just be between me and persons. How do we create that? Although it may be a minority of people, how do we create that sensibility in a way that's durable and will last?
I think you need to have an option. So, the right to be forgotten, in Europe, and the GDPR, really enforces that. To your point, even 10, 20 years ago, going into the future, you can't go to a website without actually agreeing to, click. Now we all have to click, accept all cookies on every website we go to if we're so, inclined. But that was the idea. California does the same thing. They have taken on a position to say we have to have the ability to be forgotten or not to be recorded at all if that's the case. So there's an opportunity in policy to do that. Now, the caveat is that if somebody has a life-critical condition and they turn off all the tools that are designed to be able to help manage that critical condition, they may take a hit in terms of what's recommended. The doctor may not know something which is life-saving, Now, that's their choice. To your point, that's not for us to decide. That's for the individual to decide. I'm okay taking a hit. I'm okay if my doctor doesn't know everything they need to know because I don't want to be recorded and I don't want this to go anywhere. The other thing I'll say is, of course, we have HIPAA and mental health provisions that protect that information anyway. But to your point, we should have, and we do have at Emory, the ability to say, no, I don't want this, or, in order to get this, do I have to have a phone and so forth.
That's great. And we're going to do is one more question. Representative 9, Kendrick?
Yes.
Perfect, yes.
Thank you so much. My question is around the outputs because we know AI is only as good as the inputs. So my questions are around discriminatory information put in and the output being discriminatory, and what safeguards you have towards cultural sensitivity, because obviously there are different diseases that occur in certain communities versus others, different healthcare options and things like that. So what mechanisms do you have in place to sort of check that, to make sure the AI is not giving a one size solution sort of for everyone?
Yeah, and that is, will continue to be a fundamental problem that we need to address. Now, we will what's referred to as deracialize an algorithm. So I'll give you an example. Relative to kidney care, there's something called the GFR, which is glomerular filtration rate. There were two different numbers given depending upon whether you were Black or whether you were white. And there's no physiologic reason for that to occur. And so what we've found is when we get some of the algorithms from our vendors that have those kinds of elements in them, we can actually unpack them and we can actually remove some parameters and then repackage that AI and use that instead of the one that's actually offered. So that's called deracializing algorithms. And there's literally a process and a series of tools to be able to do that. That's one way we can do it. Of course, the other way we can help is we process data, and the data that we have has what's referred to as a real dimension to it, which is race, ethnicity, and language. And that gives us some insight into the different outcomes we're seeing based on the input, to your point, because the input is biased. And so, and we'll see, there are occasions where we'll see something where one population is hitting 65% of where we want them to go, and the other one's hitting only 50% where we want them to go. And so by looking at things and every piece of data with a real perspective, with a race, ethnicity, and language perspective, we can at least find those situations. And then we have a process to deracialize those algorithms, but it's not going to be perfect.
Okay, I know we could talk for another 2 hours on this topic. Appreciate this very informative presentation. I know we'll likely have some follow-up questions, and if it's okay, we'll certainly be reaching back out to you and through Sydney and others on the team.
It'd be my pleasure.
Thank you. Before I turn it over to my co-chairman, I do want to take a moment, though, and recognize someone who's here today on this committee who drove over 200 miles on his birthday, Senator and Chairman Max Burns. Happy birthday. Let's give him a round of applause.
I would not want to be anywhere else.
Happy 29th, my friend. Happy 29th.
Okay, so let's Emory University Healthcare, nope. Oh, I'm sorry. Augusta Medical College, Dr. Miller. Thank you. This is what happens when you write on here and don't have a real pen.
That's all right. I did go to Emory, so I have an affiliation. So it's nice to be with you here today, and thank you for the opportunity to talk on this important, broad and evolving topic. As a medical educator, former dean, and practicing cardiologist, I am going to give you my perspective on where we stand in terms of preparing our workforce, both physicians and other healthcare professionals, to address, use, and manage the power of AI as it's currently rapidly evolving. And it's a formidable challenge, as you are all undertaking from a policy standpoint, a regulatory standpoint. There's a lot of unknowns. There are a lot of risks associated with this technology, and the development of a technology and its insertion into any work environment is particularly bereft. But what we have here is a unique interface, which is a powerful technology and people's health. And that creates a special responsibility for all of us to consider. So thank you for this opportunity. Let me grab this here and away we go. So my introduction to AI as a technology trend began when I wrote this article with Eric Brown. Eric Brown trained Watson to win Jeopardy. And when I met him at IBM Research Triangle in Yorktown Heights, New York, about 8 years ago, he was among 3,000 research scientists working at this IBM Watson headquarters. And I walked in the door as a physician to check on how our students were doing there as interns in the program. They spent summers there. They did extra study there. They kind of helped with research projects, right? And he said, you know, I'm so glad to meet you because we have all the answers. We just don't have the questions. We don't know what to ask this technology. It's powerful. It can do many, many things, but we need experts, domain experts like you as a physician to tell us what we should be studying with this powerful technology. That remains the problem with AI. People working in very, very unique and powerful technology sectors are not always sure how to apply the technology. And they come to health systems like Emory and come to medical schools like ours, and they interact with us. And I just want to make the point, if I can right now, that those interactions are incredibly important to developing new technologies in an informed way. And we'll talk about that because I believe it's a professional responsibility as physicians, educators, and healthcare executives to sort of foster that. Around the time we wrote that article, the American Medical Association introduced a position paper on augmented intelligence, which is another way of thinking about artificial intelligence, helping humans to do better, right, than they're doing on their own. And they encouraged us to educate students about the power of AI in healthcare and create content to create what we call literacy in this new field. So at MCG, we went ahead and decided we would try to undertake that, bearing in mind that the medical education environment is a data-rich environment. We generate data on students all the time, continuously, longitudinally, in various different ways with various different aspects of it. And it's good data. That's the good news about it, because a lot of data that AI works with isn't great data. But this educator data we collect to keep our medical schools credentialed properly and to make sure the quality of the medical schools at Emory, MCG, all the other ones in the state is good, is a very dense environment. And what you're looking at with AI is information flow, data flow, to help you make better decisions using the technology to inform those decisions. And so we have an environment where we thought we could work with student data to do some of that. Part of what medical school also is, besides fact acquisition, is skill acquisition, right? So you're not just learning material, you're learning skills. You're learning how to operate and do procedures and communicate with people, patients, and your colleagues. And that skill acquisition is another important way we think AI can be helpful, especially generative AI, as we go forward into this new exciting generation. So before AI, we would work with patients. We would work with simulated patients, real patients, trying to deliver patient-centered learning in this environment, have students look at x-rays, examine the medical record, look into people's eyes, read their EKGs, do all the things that we normally would do, examine the patient. And in order to move forward, we would basically acquire human knowledge and expertise in the process of doing that. And to the point where they'd acquired enough of that knowledge, they would graduate from medical school and go on into their training. In the future, it's very possible that we can take information about patients, actual data on patients, and create virtual patient machine learning interfaces where we can create models that actually inform our students about how the technology is improving their ability to predict future diseases, or to read an x-ray using a heat mapping technique that's already been developed, or to look into the retina and not just see lesions in the eyes, but also see the likelihood of diabetes in that patient and their hemoglobin A1C level. This technology exists. I review papers all the time that provide narrow AI applications for how one can use technologies to actually care for patients, but they're also all available to our students to help them learn how to practice medicine in this modern era. When I went to medical school, there was no such thing as an electronic medical record. Since I've been in practice, we have seen generations of EMRs and PACS systems and other technologies come into the practice of medicine. It's very hard to go anywhere in the world, the developed world, and not be part of that system. We never prepared ourselves for that transition. I think we have an opportunity to prepare our students for it now. So we introduced the first in the country AI in medicine course. In 2020, just before COVID, we introduced this course as an elective for students, and it was very well subscribed, and our School of Computer Science and Cyber participated in developing this curriculum. And it was well received by the students. They were interested, excited, and I obviously want to make the point that wherever you're looking at new technology, the new adopters of technology tend to be younger than older folks that are practicing and has set practice patterns, right? And so we used an IBM Watson Studio interface, commercially available, easy to use, introduced them to data sets in genomics, data sets in imaging. It's a powerful tool already being used all the time in genomics and imaging, as was pointed out in the previous presentation. We did some instructional videos on YouTube. It was just a sampling of what AI could do in 2020. Since 2020, everything has changed. There are sort of three phases to AI, and I just think you know these, but I'll just mention them just so we're on the same page. So machine learning, as one of my colleagues used to say, that's the AI we learned in high school. He's being a bit facetious. Deep learning, a month ago today, Jeff Hinton and John Hopfield won the Nobel Prize in Physics 1 month ago today for something that began something called deep learning. And since 2017, with Google's invention of a generative AI model called BERT, since 2017, we've seen an explosion in generative AI technologies such as ChatGPT, et cetera. Nothing has moved faster in technology than this. People's care is being appropriately considered in the context of this technology, as you heard in the previous presentation. We must prepare the healthcare workforce for this technology going forward. The course was well evaluated, it checked some boxes. The point is that it was a success, and other medical schools around the country have since done courses. I'm sure Emory's got a course or an elective in AI in medicine as well. We also realized that we collect a lot of data on students, and that data on students could be used conceivably to classify them differently than their grades on examinations, right? We collect behavioral information, we collect maturity information, we collect entrustable professional activities. We collect a ton of information. We found when we did a very simple machine learning analysis of 1,288 MCG learners in years 1 through 4 of medical school, that we could cluster them differently than we ever thought of them before. You usually think of the top 10th percentile in terms of the way they're scoring. This was a much different way of thinking about students, and it actually told us more about them, and it helped us to give them more advising than we were able to give them in the past. Interesting idea. It's been done elsewhere. We were the first to do it and presented this at Georgia Tech back in 2019. It gave us an accurate classification of medical learners in 4 unique clusters in different ways. It reliably predicted their academic outcomes in different ways than we thought of them. And it gave us the ability to track an individual learner as they move from cluster 1 to cluster 2 and perhaps create a red light if that's a bad move for the learner, which was interesting. We created an app called Aptitude for learners to use, so that they could perhaps predict what they'd be better training at in their residency programs. Would they be better in a cognitive internal medicine discipline or in a more surgical discipline? All these things are the kinds of things that learners need and that AI can potentially give them. Now, just to make the point that I made a moment ago, large language models are incredibly powerful technologies. The first was invented in 2017. This is the number of parameters that they're trained on now. GPT-4 was trained on 1.8 trillion parameters of text and imaging, scraped from the universe of information around us. ChatGPT-5 is going to be introduced probably in early 2025. It's 100 times more powerful than GPT-4. It's going to approach augmented general intelligence. I'll show you a graphic on that in a moment. 2025 will introduce us to the first edge of AGI. How will our learners, how will our providers, how will our caregivers deal with this powerful technology? This is just a busy slide which makes one point. ChatGPT 3.5 in 2022 just barely passed the USMLE examination that all medical students have to take for graduating from medical school. It did this by looking at 305 of 376 questions that humans would have to answer. So they culled out the ones that the machine could do well on. But the take-home message is that a machine can pass a test that medical students pass. So it's partly true and partly untrue. One has to be careful about what one hears about the potential for AI and what it actually can do. This technology could not pass the true USMLE test as it's given to human students. Nor could it actually replace radiologists, as this slide suggested back in 2022 as well, when individual residents in radiology who were taking their board exams in Great Britain were compared to AI technology for reading images. And when they carefully culled images and showed them to a machine, they actually performed about the same way as humans did. But it isn't human performance if you're eliminating a quarter of the questions or the cases from the analysis. So humans still outperform machines, even though the literature begins to tell us that they're doing just about as well. In this American Medical Association survey, you can see that about 1 in 5 physicians in practice currently who are members of the AMA, not every physician, actually use some ChatGPT in their professional life, and about 1/3 use it in their personal life. These are early adopters. These are the people that are more likely to use other technologies perhaps as well. In this 2023 survey, though, a significant number of U.S. practicing physicians is using ChatGPT professionally. It is a completely unregulated, HIPAA non-compliant technology. I'll repeat that. It is not HIPAA compliant. It's not regulated in the US or in Europe. It is something that we all need to understand and participate in, as you are understanding, to create policy and protections. This is an interesting graphic that once again shows the compute power between 2018 and 2028, I'm sorry, in the LLMs, the large language models, showing that they have increased dramatically and logarithmically in their ability to compute. And as I said earlier, by 2028, it's estimated that they will achieve AGI, which is that intelligence that would be part of an AI scientist's capabilities or some other researcher in the field. That's a powerful technology, and that's predicted by several people in the field, including this former OpenAI scientist. So I'll conclude then with when everything's moving that quickly, and when a technology is powerful and you want to introduce it to your learners in a responsible way, arm them with a tool that they can practice with, they can improve patient care and safety with, the things you need to do have to be to accept the fact that you have a professional responsibility as a professional to use a technology wisely and appropriately. In this article that I wrote for NPG Digital Medicine, which is a Nature journal, I pointed out 4 things that I believe that are the responsibilities of physicians and healthcare providers, which we are imbuing to our students and our learners and our colleagues. First of all, you have to be willing to lend your knowledge, expertise to the computer scientists, as I mentioned at IBM, in order that they can build models that are real world models that don't have unexpected causal inferences or other things that are not part of their knowledge base. They have to be informed by the practice of medicine, the reasons that you make decisions the way you do, so that they can build a model that's understandable and that also is relevant. Number 2, you should have a degree of AI literacy. If you're going to use an AI tool in the real world in practice, in the clinic, in the classroom, you should have some understanding of the fact that there are black box AI models that are hard to explain to individuals. And if you're going to tell somebody that their risk for a genetic disease is increased, you should have some understanding of how it is that that model reached that conclusion. Is there a bias in the model? Is there a data bias? Is there a computer modeling bias? There are biases everywhere. And it's been pointed out that we have to always be on the lookout for these biases and understand them. Data provenance, as someone said earlier on the committee, the quality of the data that goes in determines the quality of the model. We have to look at the data quality and look for biases in the data, because it can certainly impact the quality of the model as well as its scalability, reproducibility. And finally, I think it's a responsibility of providers in the care setting and of others that work with patients to get involved in data inputting and quality assurance. If you see something, say something is what we say sometimes, right? In the healthcare setting, if something doesn't look right, you should mention it. If you're using a model and it doesn't appear to be equitable, if it doesn't appear to be accurate, if it doesn't appear to be reproducible, you should say something, because the people that are helping to implement the model may not have seen that in the real world. The toughest part about the FDA's job these days, and Bob Califf is a colleague of mine from cardiology, they've approved over 1,000 AI applications at FDA. They are having a terrible time doing post-AI, post-release market surveillance. That's a requirement of approval. They can't do it. They can't look at what the technique does in the real world, because if it is changing the real world, that's the responsibility of the company to modify the technique, but they're not able to do it through FDA oversight at this time. So, couple of personal quotes. This is my take. This does not represent MCG or AU, but I think the willingness to adopt AI is not the same as an individual organizational readiness to use this potent technology responsibly. It's great to like something. It's good to be excited. Willingness to adopt is an important part of new technology insertion, which I think is important, but responsibilities to use it in a proper way and understand it is incredibly important. And I also would make the point that in order to assure patient safety in every state in this union, every country that I've ever practiced in, medical licensing agencies require that you continually educate yourself and certify and credential yourself in a variety of things that are listed here. If we're going to use AI at the bedside, why wouldn't AI credentialing be something we would do? It would make sense to me to have some belief that the person that's taking care of me has at least obtained some basic understanding of what AI technology can do and how to use it responsibly. So I think that we may be talking about that at some point in the future. I'm not sure. My own personal thought. Thank you very much.
Committee, with that, open up for questions. Okay, what mic are you at? Is that 1, 2?
Number 2.
All right, Fred, thank you.
Thanks. Dr. Miller, I love your quote. We have all the answers. We just don't know all the questions yet. And it seems like you're providing the tools necessary to gear your students towards the right questions. So I commend you for that. But you're also collecting a great deal of data on the students. And going back to Senator Seltzer's question around transparency and choice, for me as a student, how do I know what data you're collecting of me? And if I have the question today, how long will it take for me to get an answer to that question?
Sure. Good. Excellent point. So when we entered into that study that I described, where we were collecting information on students, we have to collect information on students and report it to them on a routine basis as a matter of course, just to run the medical program. We told them we were going to work on this as a part of a research project. They all said that they were fine with that. So we got their permission to do it and got a IRB approval, we call it, to do the study with the student data. It's incredibly important that people know that their information is being used, even if it's being used anonymously or a de-identified way, to help to understand how a situation can be improved or how safety can be achieved or outcomes can be improved upon. So we do fully support the fact that when people are collecting your data in any setting, you should be aware the data is being collected, and the approvals you should give should be meaningful. They shouldn't be fine print like the things you sign when you get a new cell phone, right? Where you really can't review it all and you have to accept it without really being able to review it in detail. So we believe that patients, learners, anybody whose data could be part of a data repository that could be used for any purpose, commercial or public, whatever it might be, should be aware their data is being collected and should consent in some way to the fact that their data is being used for that purpose.
Thank you.
Representative Golod.
Thank you. So my background is computer science.
Good.
So AI is definitely intriguing, especially where we're going. I do have a question though. I believe that people generally are creatures of convenience, and that's it's part of the reason technology is become so big in our lives. So how do we how do we ensure? So a lot of times that doesn't matter. So if I forget how to, if just in a lot of situations, if an AI can't predict when I want to wake up in the morning, what my AC should be in the afternoon when I get home, that doesn't really matter too much. It's annoying, doesn't matter.
Mhm.
But how do we make sure that our doctors in our medical field don't become like intellectually lazy and so reliant on AI that they can't actually, practice medicine?
Mhm.
If something happens with AI or there are biases, that they can realize, hey, there's a bias here, not just
Yep.
accepting what's there.
Yep.
How do we just keep them, not so reliant on it that they're not practicing medicine on their own. They're just, asking really good prompters of AI.
Well, that is an incredibly foundational question in almost every field, but I think it's incredibly important in medicine and healthcare. Technology can be a tool. We know that it can help us to do our jobs better, more reproducibly, more efficiently. It can even provide a degree of interaction with patients that humans can no longer provide because of staffing levels, let's say. But there was a good example of that with the LiDAR. But what one has to do, I think, and it is part of, I believe, of a professional responsibility, which we need to teach our learners and then our graduates and eventually our colleagues to believe in, that they should never use a tool as a crutch. A tool should always be helpful. A tool should always allow them to inform their decisions a little bit better, perhaps, than they would be able to on their own. But I think if you reach the point where AGI was among us, right? You really had such powerful technology that it could almost provide decision support and decision analysis, which is where they're working towards. You'd really have to be careful about how that information is used in real time. So there's something called contextual adaptation. It's a kind of a DARPA imagined future state for AI, where people walk into the emergency room with chest pain, the AI is helping them to practice almost in real time, right? And it's saying things, well, I understand you're going to make a mistake. I understand you're going to give the patient this medication. It may cause a side effect. It's not quite telling them what to do, but that dance between those nuanced, informed decisions and decision replacement is what we have to always be very concerned and careful about. So I think the key thing for us as a profession, as a system of care, as a policy branch of any government, is to make sure that the risks are understood. And when you understand the risks, you can often manage them much more purposefully and much more productively, right? This is a risky proposition. It couldn't be any more risky than it is in healthcare because of the stakes. But having said that, the benefits could be considerable, right? So the efficiencies obtained, the safety measures, operationalized, the ability to support and augment human beings in a very complex environment, all those things are huge upsides. So it's just up to us to grapple with this and move forward with the expertise of people in the medical and computer field and other fields that relate to it. But it's a good question.
Thanks. Yep. And it's absolutely a tool, just making sure that we're still, but if the grid went down,
Yeah.
can doctors still practice? That's,
I will,
makes it less more difficult. X-ray machines are amazing, needs power, or
sure.
MRI, but
As I found out when my daughter went to have her surgery on the morning of Helene hitting Augusta, you can't operate when there's no power. So
thank you.
So I actually have one more question before we change speakers. One of the biggest things, I don't know if you're aware of this, but we're in this thing called open enrollment right now.
Mhm.
And it seems like every year I never get to see my rate go down. And I'm not, can you talk a little bit about the use of AI and how it can be used to lower the cost of administering medicine?
Well, that's a very important and somewhat loaded question. So
Very, very loaded.
I will do my best to not step on any landmines. But so I happen to serve on the University System of Georgia committee that is responsible for annually assessing the cost to that system of its health benefits programs, including its drug benefit program, right? And every year the cost of medications goes up, and the more expensive medications become more expensive, it seems, and the benefit to the individual is reduced, right? Because you're paying more out of pocket, right? That's kind of the way it goes. And with any technology, or any new scientific breakthrough, there is a cost of that technology that's baked in to the business model so that companies can recover their investment, right? It's a capitalism oriented business thought that I think makes sense to most of us. The problem is that two problems that I think occur. The time over which that recovery of profit to repay investment occurs isn't really understood. It's kind of market driven. It may be regulated in part by patents and things of that sort, but it's a bit of a hard to predict system to negotiate, I guess I'll call it. The other thing that occurs is that you end up in a situation where the factors that drive that recovery of cost, there are intermediaries that come into the process. Pharmacy benefit managers being the biggest change that has occurred in healthcare in probably the last 15 years, right? So there's a middle person in between there, right? And that middle person is a facilitator of drug delivery, especially specialty drugs. And those specialty drugs and the cost of that service are baked into now the cost of care, right? Just in general terms, anytime you can understand cost recovery functions as it relates to your cost of doing business, anytime you can understand the cost of intermediaries being inserted into a business model, you are better off understanding whether you're overpaying, underpaying, or paying just the right amount for a service. Those are just general principles. I don't think I will or be able to give you specifics in response to that complicated question, though. It's a good question.
All right. But with this, I'll turn it over to Chairman Albers.
Thank you very much, Dr. Miller. Very impressive. I know there were committee members that had additional questions, so if we could, we'll make sure contact information is there. Maybe we can do some follow-up after this as well. Next, we're going to hear via Zoom from Amazon. I think we've got Maria and Brad on the line. If we can make sure they're unmuted and we can hear you okay.
Hi, good morning, everyone, and thank you, Senator Albers, for allowing us to meet with you today. I will say I can only see the video, so please let me know if the Zoom, I'm sorry, if our presentation is up already.
All right, give us 1 second here. Are we going to present that, or are they going to do that from their screen? You should be able to share your screen, Maria. Could you give that a try?
Yes. Sorry, one moment. Okay, we might alternate. Brad, would you mind presenting on your screen? And then I lose some capabilities in reading our notes.
Sure thing. Step by 1 sec.
There we go.
Wonderful. Excellent. So thank you again, everyone, for your time. I'm happy to be joining this study committee again. I had the opportunity to present last year from a high-level view on what or how AWS views AI machine learning. I'm excited to be joined by my colleague, Brad Dispenza, who's part of our security specialty team, to talk a little bit about how artificial intelligence is being utilized in the justice and public safety space. Okay, so we're going to cover today just simply 3 major areas. AI 101, I know most of you have heard it, but again, it'd be a good refresher to hear from us how we see this technology over here at Amazon Web Services. To talk a little bit about some of our use cases, and Brad will cover that. And then finally, just a small perspective on the regulatory landscape that is emerging generally, but also with regard to the use of this technology in the AI space, or in the justice and public safety space. Okay, and just for a general awareness, Amazon Web Services is Amazon's cloud computing business. We began offering cloud computing services through a network of global data centers in 2006. We did that as a result of our own internal needs, supporting Amazon.com and our emerging business lines. And we learned very soon that our services were quite unique. Flash forward to today, and AWS is supporting millions of active customers all around the world with a very robust global network of infrastructure. And one of the most exciting innovations or technologies we're going to utilize or support our customers with is artificial intelligence and machine learning. As many of you know, the use of these services is highly dependent on cloud computing, and so we're happy to grow and support our customers in this way. The best way to think of AI, artificial intelligence, or the way we think of it, is sort of an umbrella term. It's a term that's often conflated with multiple, phrases, technologies, and certainly images of, robots taking our jobs. But we see it as one type of technology that is evolving and growing and has multiple components. So AI is a way to describe any system that can mimic or replicate tasks that previously required human intelligence. So not necessarily new, but artificial intelligence is a use of a system or technology that ultimately mirrors a process or a task that a human does currently or once has traditionally conducted. Within that is machine learning, and it's a subset of AI that uses machines to search for patterns in data to build logic models automatically. The way that is done is by analyzing large amounts of data to determine patterns in probability. So using information to make logical predictions. When we process data through machine learning algorithms to ultimately yield informative insights or regular patterns or regular results. So you'll see through our use cases today some differentiation between how we talk about machine learning to support functions that could also then be used to support functions within to create an AI impact or effect, meaning sometimes the combining machine learning functionalities into certain algorithms or patterns can yield an artificial intelligence result, meaning something that a human might do. Large language models and generative AI go beyond just the regular predictions of machine learning to provide results. It takes extremely large amounts of data from trained large language models and uses various AI techniques to generate new content. So the best way to think of this is if you are looking to develop a photo or an image of a puppy flying in space over the desert, you could type that ultimately into a LLM and generative AI query or function, and you might be able to generate an image that looks just like that. So the large language models aggregates machine learning capabilities to create new images. And I think this, to some degree, generative AI is what we think of as both the most exciting forms of artificial intelligence and machine learning, but in some cases, some of the most, risky or concerning, if we're being honest. AI has the potential to be a truly transformational technology for our generation. And I think one thing that we want to talk about today is certainly that it also has the potential to solve some of our humanity's most challenging problems and augment human performance and maximize productivity. But it doesn't always have to be that it's the scariest and most risky scenario. There are a number of use cases and ways that we're using AI and machine learning today that are safe, that really help communities and public sector bodies like justice and public safety organizations to support either policy objectives, community goals, and maintaining safety in the overall environment. Brad, if you wouldn't mind hitting next. So I just wanted to share this slide because it covers sort of some of the places we as AWS are seeing our customers utilize artificial intelligence and machine learning in that entire umbrella that I just mentioned. There's really no industry, private or public sector, that won't get to utilize AI and machine learning for the future. And again, as I just mentioned, the way that we're doing that at AWS is often in really innocuous or small scale approaches. And that's because we support our customers by providing them the actual building blocks of these technologies to help them deliver results for ultimately their customers. So the best image I can provide is like Legos. We are providing you a Lego kit of technology services in the AI and machine learning space. And together with our customers, we are building these really interesting end products to support the solution or the progress on challenges or processes that need to be improved or can derive greater efficiencies through those technologies. I would love to move to our next slide, Brad, so we can talk about how we're seeing this play out in the justice and public safety space. And actually, it would make sense. Brad, do you want me to share my screen?
I can drive it if that's okay.
Okay, great.
Awesome. So I'm Brad. I'm a principal security specialist for AWS's public sector team. So my team works around the globe with our public sector customers on issues that just deal with security and compliance. And I'm excited to talk to you about some of the use cases that we have around justice and public safety in this space, because I think it's a good example of different solutions that I think are using this capability as a tool to solve real world problems. The first one I think that a lot of us can resonate with is the difficulty that most municipalities are having with overloading 911. So in this use case, we worked with Jefferson County to help them to reduce 911 staffing shortage issues by augmenting non-emergency requests to go to a solution that's being powered by Amazon Connect. So what this is allowing us to do behind the scenes basically is to address when folks are calling into a 911 solution, but they're not actually dealing with a life-threatening emergency. Is there a way that we can reduce that operational burden on those dispatchers and on those folks that are actually fielding those emergency calls, but also tie directly into things like computer-aided dispatch so that we can put them into the queue properly and can get the issue that they're trying to get resolved in a timely manner? And so what this allows us to do basically is when we have a situation that's being automatically routed to this system, it allows the individual to, for example, say I have a property trespass issue, or I have an issue where there's a need for a non-emergency law enforcement support request. If the sentiment analysis is able to detect that, in fact, this is an emergency call, this still has the ability to route to a 911 dispatch operator for that more timely and emergent capability. But this is really helping to reduce that operational burden of automatically addressing those non-emergency calls placed to the 10-digit lines. Another one that I think sort of resonates in that space is using AI to improve call center efficiency. So I think most citizens can appreciate that, calling into call centers can be challenging. In one case in the county of Los Angeles, they were looking at a peak hold time of between 40 and 50 minutes. And that's something that they worked with AWS closely on and trying to reduce that burden to their citizenry. Is there a way that we can use this technology to reduce that time and also to help the folks that are actually in the call center to operate more efficiently? So what this is really using a chatbot and self-service capability to, again, reduce those hold times to roughly 3.5 minutes. And then we went a step further, working with the provider and the county to actually provide sentiment analysis to evaluate customer satisfaction levels in real time. And so that's things like, is the customer happy? Is the customer getting frustrated? Is the customer angry? And that really helps in that sort of real-time feedback about whether or not the solution or that the individual is kind of experiencing that challenge with the solution and the operator. So this is a good example of, again, using this capability as a tool to help solve those real world problems. This is an example of using AI to alert citizens. At a high level, this is basically using IoT sensors to notify if we're in an area that is exposed to potentially life-threatening issues around flooding. But it's also using consumer technologies like an Alexa device to provide citizenry with that real-time information about, hey, there's an impending flood. So this leverages a network of IoT sensors and enabled water sensors in the field from an IoT perspective, but that also provides information back to that consumer device, in this case, an Alexa device, to help notify those citizens with information that could be timely and emergent around flooding. This is an example that I think is candidly the strongest example of where AI can really start to come into a useful paradigm. One of the things that we worked really closely with the LA County Public Defender's Office was using AI to improve case management. And I think that this really strongly shows how you can effectively use this as a tool to reduce operational burden. In this case, the Public Defender's Office has a situation where they're getting case data from up to, I think it's 99 different possible law enforcement agencies or folks that have the ability to report into crime. And the challenge with that is that the public defenders have to basically take all of those different sources of data, and they have to do manual data entry to take all those sources of information, combine them, search for information that could help provide their client with possibly, significant capability to address a legal case against them. And so I think most folks are aware that most public defender organizations are struggling to keep their head above water. And when LA County looked at what it would take to simply scan these documents and then try to do some sort of import OCR operation, they found that basically it was going to take a large number, dozens of caseworkers basically that would have to take 24 minutes per box to do one of these. And then they would have to scan that out over a number of different centers that are operating with these case files. What they were able to do in partnership with AWS is we did a proof of concept with them where over the course of 20 weeks, we put together an end-to-end solution that allows them to take these case files and then actually tie it into a system where we're able to extract all the different information about the case file, who filed it, where did it come from, what case number was it. And this allows the defender to seamlessly have at their fingertips information about all of the different sources of data that could be beneficial to their client. So this was a system that ingested scanned PDFs. It did data classification of useful pages specifically. So basically it helped them to identify, hey, this information in this document is probably highly relevant to you and to your case. So again, reducing that burden on that public defender. And the other part that I think is important is that it speaks really highly about the fact that there can be issues with artificial intelligence. And so one of the safeguards that was built in is that it allows the administrator or the operator to go and verify the results of the data to say, like, how did you come up with this? Where is this coming from? So that you don't get into a situation where you're presenting in a court of law only to have a document that doesn't exist. So again, really strong example of, I think, using artificial intelligence to move forward action for citizenry. Another example I think that is also easy to understand is using AI to improve safety and compliance. This is an example where we could use a technology like Amazon Rekognition to tie into closed circuit television, CCTV, or other video recording devices to detect, for example, personal protective equipment or PPE to improve worker safety. So we're on a site, we want to make sure that all the folks that are working on that site have hard hat and a required PPE installed. But it's also using that same type of technology to address things like analyzing, for example, vehicle traffic or pedestrian bicycle safety. So looking for signs that maybe a pedestrian has been impacted in a crosswalk. If you can think about things where we're in a situation where we need to identify, for example, a red car that was involved in an incident, being able to quickly use this type of recognition of information coming from those cameras to say, hey, show me all the red cars in this intersection quickly, is something, again, that can be used for law enforcement purposes to expedite what could be a very timely situation. The other one that we wanted to call out is using AI to improve cybersecurity. And so this was another example of working in concert with the city of San Diego to implement what they called an e-CISO. And really the idea was that we're using chatbot type capabilities to allow the folks that are interacting with the Office of the CISO to perform more automated interviews to assess and grade their cybersecurity posture per a standard like NIST or other recognized frameworks. And what we see is that working oftentimes in compliance, this is a challenging space because performing these types of posture assessments, these types of assessments is very human labor intense. It takes a lot of time to sort of go through the back and forth of that question and answer session. And what we found is that when we're using this type of chatbot technology with these specific policy frameworks, it allows you to more accurately and quickly provide feedback based on sort of what would have taken a human interview process a significant amount of time to schedule. Now they can do it on their own period of time. And it also provides recommendations on how to improve their cybersecurity posture based on whatever cybersecurity framework that they're actually using. So this includes things like the ability to do summarization, search, Q&A, and again, a really strong example of using this underlying technology to quickly reduce friction for something that oftentimes can be challenging, which is compliance. So I'll throw it back.
Thanks so much, Brad. I really appreciate it. So I love all those examples because I think it really highlights that organizations in the public sector space and in the justice and public safety space can actually utilize these technologies, these really forward-leaning technologies in what we might think of as really ordinary ways to create improvements and better outcomes in the day-to-day. And I think that goes to a point for policy development, which is policymakers are in a really unique position of trying to instill the right and appropriate guardrails to ensure the technology is used responsibly with the best of intentions and mitigate possibility for risk or liability or harm to individuals or organizations, but at the same time embracing the use of that technology. And with anything, whether it's artificial intelligence or machine learning, the best way to ensure better outcomes is to actually use the technology. Like humans, practice makes perfect, and we need to enable the technology used for it to get smarter. And then with machine learning, it is really about the ability for using large data sets to create patterns. And so one thing in my work supporting policymakers and governments is helping them to embrace use, even in small cases, to learn and progress on larger enablement. With policy, we see AI machine learning being a key component of business, economic, and governmental and education initiatives and everyday life, really, for the future. And given that these technologies take on a human role or a human perspective, we do think that the technology should really be human-centric and really incorporate benefits for all individuals and community members. How we're seeing regulation at this time and what we think is sort of a way forward is really ensuring that AI machine learning incorporates a risk-based approach and appropriately assigns actors to address those potential risks. So like with cloud computing or some of the IT-focused technologies, many of you have come to learn about, it's really about making sure there's good education and understanding of how the technology works. Moving forward with proper understanding of what potential risks may look like. And again, that means that you can incorporate the use of these technologies in sometimes controlled environments to get greater familiarity with how it might look. Something we're really striving for when engaging public sector individuals is ensuring elimination of errors. Again, the use of regular use of the technology ultimately enables better results, but that doesn't mean it's not without its own failures or limitations. And like Brad mentioned, sometimes the technology will have errors. So it's about forecasting kind of what the potential opportunity for risk may be and trying to navigate, guardrails in that regard. We also know that bad actors certainly do come into play. Coming off of an election season, we had a lot of that conversation in the ether about newly generated content. It's ensuring that we understand and can properly identify when and how certain content is perhaps generated by a machine and not truth or maybe a fake image. So also an opportunity for increased education and better understanding of how the technology works. IP. With AWS, we are offering the building blocks, those Lego blocks to support our customers in building new functionalities, new products, new services. And with that does come concerns around, intellectual property, and also using existing intellectual property for data and putting them through those models. So we are constantly working with our customers around who owns input and the output and what that looks like. And I know certainly of major concern for this chamber and the legislature this session is around data privacy. Data privacy remains a key component of how we support our customers, and it is a critical feature of how we view safety and navigating AI machine learning in this space. Organizations can do a lot to set up those guardrails around proper data privacy mechanisms, and then also use existing policies, whether it's state, regulatory, or international, to support those efforts. On this slide, you'll see there are a number of policies working and organizations working to incorporate AI machine learning best practices. Those are NIST, the EU AI framework, and then ISO, which has developed standards like ISO 42001. Colorado, this past session, the 2024 session, passed its own AI Act to develop its own conceptions of proper risk mitigation and regulation of those AI systems. But there are other models that we know policymakers around the country and around the world are continuing to consider and evolve from as we move into this terrain. Ultimately, one thing I'll point out is that there are various ways to think about how we use regulation and policy to address the concerns of AI technologies. Some of them exist in current legislation and policy today, and then can be adapted to incorporate AI machine learning for additional perspective. And certainly there will be uses of AI machine learning that have not been addressed in existing policy. And I think those are opportunities to think about innovative approaches to encouraging not only use of a critical technology, but also to ensure our citizens in our country are best situated to use those safely. So that is our presentation for today. We're happy to take some questions, but again, thank you so much for the opportunity to present again before this body.
Maria and Brad, thank you. We appreciate that great update. We're going to have time for just a couple questions so we can stay on track. My question first will be, being a first responder for a few decades, we are steeped in tradition and service, and some embrace new things quicker than others. When you are working throughout the country, how quickly are law enforcement agencies, fire departments, emergency medical services, and 911 centers embracing this?
I think Brad and I can tag team on this. In terms of the use cases that Brad showed or displayed, I think one thing that strikes me is around efficiency and time. I think in speaking to our first responders across the country, the ability to cut down time to address an emergency is so critical, not only because that, eliminates potentially negative outcomes, but it's also an opportunity to ensure we're not wasting already limited resources. In communities where, unfortunately, some of these, these entities are underfunded or struggling to get resources, technologies like AI and machine learning, or even cloud computing can actually enable, smaller teams or smaller groups to scale larger and faster and wider. And I think the technology, when we speak to them about that, the technology serves as a real value add to the way their organizations operate. Brad, I don't know if you have something to add also to that.
Yeah, I'll just keep it short. So I think that as with any new technology, there are always going to be challenges with adoption. But what I've seen from the agencies that we've worked with is that consistently the adoption is higher when there's a strong proof of concept or strongly identified use case. That's why I love the LA Public Defender partnership that we had. It was something where we worked with them on identifying the problem and then working really closely with industry to come up with an innovative solution to work with them to solve the problem. So I think in reality, it's one of those things where you really need to see AI as a tool, not necessarily a solution. So you build on top of the capabilities of artificial intelligence, but sprinkling AI on a problem doesn't necessarily fix it.
Very good. Questions from the committee members? Senator Burns.
Thank you. I appreciate your presentation, your insights, especially the scope. Let's take a minute and look at your slide on regulatory landscape, which is really the challenge. Okay, so we're talking about it. We're trying to understand, and that's part of what this committee is struggling with. So the question is, what is Amazon or AWS's position on oversight? Do you embrace it? Do you welcome it? Do you participate? You're interested in participating in it? Would you rather see a state-by-state approach or a more national approach? And give us that idea from your perspective.
I think from a business perspective, eliminating a patchwork of policies, at various levels of government enables companies to better serve their customers. But I don't think, based on our experiences over the past few years, we haven't really seen a lot of movement on, a federal policy towards these types of technologies, and do see states really taking initiative to address real concerns. So, in this moment, I think we are working to support states in ensuring their policies, not only harmonize where the technology is today and the needs and support of customers or constituents, but also maintain some openness and flexibility to changing as we understand and learn more about how it's being utilized, and certainly, evolutions in our economic progress. We see policies in the AI machine learning space kind of having some layers. There are certainly state policies or federal policies that can be imposed, but as what is included in the slide here, there are frameworks around best practices and recommendations that ultimately inform how organizations adopt or align to more standardized best practices and risk management efforts. The other thing that I would say is that here at AWS, we are constantly working to ensure our customers are best situated to utilize these technologies with minimal risk. We've implemented the use of best practices scorecards, which inform customers on the individual AI machine learning services we're offering, and try to guide them on how to proceed in the most thoughtful way. And so again, in this moment, we want to be supportive to a state like Georgia who's thinking about policies like this. I think, always there's a conversation around a national policy, but there's multiple layers here to ensure that individuals and entities are best protected and getting to use this technology to improve outcomes.
Quick follow, Mr. Chairman.
Yeah, very quick. If you
Very
don't mind.
quick. Do you believe the industry can provide its own oversight and its own control, or do you feel that there needs to be a different approach?
As I mentioned, we had a really unique perspective supporting customers in the development of their own AI machine learning tools. And so we as AWS are getting a good view on what is working and what's not working, and hence those best practices, those responsible use and best practices cards that I mentioned, and policies. again, the best way to understand where AI machine learning is going is by use. And so, at AWS, where we see this as an evolving practice, we support our customers, and sometimes that means changing the way we offer technologies and also changing components of how the technologies are used. So it's an ongoing conversation. And while we're at an interesting point. AI and machine learning has both been a technology that has existed for decades now. It's not a new technology, but we're just at the beginning of its use, or more uniform or generally accepted use. And so I think there's still a long way for us to go on learning how this all works.
Yeah, thank you, Maria. I appreciate it. I'm sorry, folks. We are running a bit behind now, and I know there are some more committee questions. We'll have to do those follow-up via email and voice. Thank you, the two of you. I'll turn it back over to Chairman Thomas.
Thank you.
Thank you, Chairman Albers. We'll have mission critical partners. John. Nope. I looked at it and I thought I might get this, but I'm probably going to get it wrong. So.
Services for mission critical partners. I've always been fascinated by learning about how people have been attracted to the field of public safety. For me, growing up in Western New York State, I was invited to an open house at the local volunteer ambulance corps, and seeing as a young teenager the work that the EMTs and paramedics were doing serving the local community, I was immediately hooked and fascinated. I joined as a medical explorer scout. But even before my days in volunteer EMS and working at a busy 911 center, I really enjoyed visiting my grandfather. And he was a printer in New York City. And there was nothing I enjoyed more than working in his print shop. I learned how to take an original, make a negative, turn that into a plate, and then load that into an offset printing press and create dozens, hundreds, or thousands of copies of that information. Those printing presses have been a tool that have enabled a wide distribution of information. And it did certainly eliminate some jobs in the community. We no longer needed to hand copy and scribe hand copying books. But it did create new professions called, printers and typesetters. I see artificial intelligence in a similar light. We know that it's not going to eliminate the role of a first responder. I do see our first responders using that AI as a tool. We've heard that a couple times here this morning, a tool to enhance the speed, the efficiency, and certainly the quality of an emergency response, primarily to drive better outcomes. And that's what we're all really searching for. Every day across the United States, our 911 professionals are answering over 600,000 calls to the 911 center that range from true emergencies like a robbery in progress, a structure fire, someone having a heart attack. But, our 911 professionals, the first of the first responders, will go from answering those, true emergencies to the next call inquiring about what time do the fireworks start, or how to pay a parking ticket, or even, what to feed their new pet turtle. And many years ago, I wore the headset and as a 911 dispatcher, and those three examples, including the dietary needs of a new pet turtle, were calls that I handled. So I see AI as that tool. It holds great promise for 911 and emergency responders, augmenting, enhancing their abilities, allowing them really to focus in on the most important tasks at hand, allowing them to make better and more informed decisions, faster decisions, delivering a better experience for all those involved in emergency response. You just heard from AWS, the automated assistants being used to answer non-emergency calls immediately, being able to provide callers with accurate, verified information, literally without human intervention. So with the short time that I have, and I'm conscious that, we have a limited amount of time this morning, I'm going to talk a little bit about the trends in the top AI trends in public safety today, some future ideas about where we're going to see AI in public safety over the next 3 to 5 years, and probably most importantly, some of our thoughts about the ethical use of AI that includes a primary focus on transparency and maintaining public trust. So just a sampling of some of AI's top use cases in public safety. Again, you heard from AWS a few minutes ago, and those were certainly some good insights. That call diversion is certainly interesting because we're seeing 911 centers today that have adopted this technology being able to take what was an on hold time of 30 minutes, 45 minutes, an hour, and be able to answer that call immediately, electronically, handle it efficiently. It can even be done multilingually, right? So when I was a 911 dispatcher, if someone was speaking a language other than English, you had to get a translator on the line, and that takes time. And especially in those critical emergencies when somebody's facing a life-threatening crisis, getting that translator online, figuring out which language that person is talking, asking the question to the translator translating that question into that native language, waiting for the response. It all takes time, and being able to do that transcription, translation, using AI-assisted tools saves time. You also heard a little bit about being able to do some quality assurance. Today's 911 centers, sometimes when it's a manual process, they're only able to do a quality assurance on a very small single-digit number percentage of 911 calls, where an AI assistant could be monitoring all calls and providing some real-time feedback for improvement of the service that 911 telecommunication dispatchers are providing. Using historical data to provide some predictive response. I can tell you that before AI, there was a manual process where people would comb through the historical data and making a system response plan for every hour of the week, and strategically placing the ambulances in the right places. And coincidentally, because those are hotspots and emergency response often is very cyclical and repetitive, the likelihood that you've placed the ambulance in a location that has the likelihood of being dispatched to an emergency response is very high. And now with AI, we're able to make that automated and improve the quality of that predictive response. We also are seeing AI being used to monitor video inputs. If you go into a 911 center, they may have a large video screen up with dozens or hundreds of video inputs, traffic cameras, and that type of thing. There's no way for humans to be able to process all of that incoming data and be able to make an informed decision about what data is important. We're seeing traffic cameras being AI enabled to identify potential crash or a growing crowd, or even alerting firefighters that there is a wildfire there starting. And we can do that literally in seconds versus having to receive a call from a citizen or having to just kind of scroll through all those video inputs. And then report writing. This is an area that is incredibly exciting, and we're seeing a great opportunity. So as an EMT, as a advanced life support provider, I remember having a piece of tape on my pant leg and writing down hastily whenever I took vital signs or I was administering medication. And then we'd get to the hospital, and then I'd have to try to transform that messy scribble on my leg into a patient care report. And without AI tools, that's the situation that we run into, that we have to rely on our memory. We have to rely on hastily written notes. And now with AI tools, that data is being collected automatically, efficiently, and electronically, whether it's a mix of body-worn camera video or audio. Dr. Erskine mentioned adaptive listening, which I found to be exciting because in the same kind of scenario of emergency medical services, pre-hospital care, as well as in-hospital care. And that AI tool can take all that information in and draft that report so quickly. That reduces the quality back and forth checking. If you're a law enforcement officer writing out a criminal complaint or a report, that information has to be transcribed, and it's taking hours of time. Sometimes it goes back and forth between a supervisor, correct this or fix that type of thing. And all of this, the capability gets us to the point where we can put responders back out on the road, responding to actual emergencies rather than at the hospital or in the station writing a report. So where do I see AI over the next 3 to 5 years? And I can tell you that, as it's been said a couple times, AI is literally changing each and every day. So some of these things that I are saying that are 3 to 5 years out, we're already seeing that kind of thing. I said that, that we would see AI-powered drones and robots, autonomous vehicles helping our response to emergencies. But literally just a month ago, when in the response to Hurricane Helene, we saw these AI-assisted drones going into these emergency sites, bringing video back about these disaster sites, both here in Georgia as well as in Asheville, North Carolina. AWS was talking about helping AI assisting with cybersecurity, and we know that we can help protect by analyzing large quantities of network data, user behaviors, identifying threats before they become critical, trying to notify humans, I think is going to be the key factor here about their ability to identify a problem early and take action with it. And then I also see augmented reality helping with navigation assessment. I could see firefighters going through a building, having some type of visual display, being able to understand based on pre-planned information about where certain hazardous materials are stored in a facility, or seeing real-time temperature information in a fire that would help make them respond better. I can see, again, back to a 911 center, because 911 is so close to my heart. I could see AI creating a shift summary of information. When I would go in to the 911 center and do a shift change, and you'd ask the dispatcher, what's going on? They'd say, everything's fine, nothing's going on. And then, a minute later after they've left, a police officer pops up on the radio and start talking about an incident. And the expectation was that I knew what was going on. Imagine a scenario where AI could do a shift summary about the last 8, 12, 24 hours and alert the oncoming shift about the things that are going on. Maybe that there was a missing person 4 hours ago and we're looking for a vehicle that has a particular description. Again, to remind the 911 telecommunication dispatchers, we should be keeping an eye out for that and listening to all the incoming 911 traffic. And if something similar, again, alerting the telecommunicator that this might be related. You can imagine creating a scenario where having to report out to elected officials about what's going on in their community, helping to advise them. And an AI summary, again, can be automatic and electronically and accurately performed. I was fascinated when Dr. Miller was talking about providing education, and I see great promise for us being able to educate and train our first responders using AI-assisted tools, whether, again, it's in the 911 scenarios where I can mimic a scenario of a live emergency call with confusing or conflicting information, background noise, stressful situation, and I can customize it, and it don't have to play a recording of some call that happened before. There could be scenarios today where, again, with swatting type incidents, that many 911 centers have never experienced that in their 911 center, but I could train for it because I could use AI-assisted tools that understand how swatting incidents occur using the social engineering tools, and I can protect our local community even though they've never had that experience. In law enforcement, I can see a situation where we could help law enforcement officers, both new and seasoned law enforcement officers, practice their de-escalation skills, handling confrontations and high-stress incidents or active threat scenarios without, again, endangering anybody, and in a safe kind of training environment to improve their skills. With the fire department, fire rescue, again, today, Senator Albers, you've probably been in a training scenario or two where you're lighting a building on fire and you're sending people in a hazardous scenario. Imagine using AI assisted tool that can mimic that fire environment, or you can introduce certain scenarios that you can't physically do in a training environment, and again being in a safe situation that does not risk the health and safety of the firefighters in a training environment. We can help with different scenarios that again they may not be able to physically create in a training environment. And then again, like the doctors talked about earlier today, being able to provide pre-hospital medical training that would help EMTs and paramedics diagnose and treat conditions, trauma, cardiac arrest, stroke in real-time AI scenarios. Dr. Miller talked about being able to track progress and being able to uniquely assign maybe different scenarios to the needs of individual trainees. That adaptive kind of scenarios can work both for new staff as well as for seasoned professionals. I can see a scenario where someone who's been a paramedic for 10 years, that, okay, all the basic things, you've seen a lot of things, but maybe there's some things that you haven't been exposed to or haven't been exposed to with enough frequency. And that would be a challenge, and it would help them refine their skills and help them train other people, which again is one of those key factors that we see, especially in scenarios where we know that there simply aren't enough humans to do all the work that we need. And I also see this, the question earlier was about cost and reducing costs and risks. I can see great opportunity for us to leverage that technology, especially for rural EMS, where we just don't have enough trained and experienced people to do that training. So I'll just end on a few moments to talking about the ethical use of AI, and in particular, the transparency and maintaining public trust. The responsible use of AI in government is of critical concern. The public expects our elected officials to ensure that AI is applied with full transparency, with rigorous oversight and immediate correction for any instance of bias. This is a scenario where, our margin for error is effectively zero. We need not only to implement AI accurately, but we need to be seen as fair and impartial in doing so. And the most important asset that we have, the most important asset the government holds is public trust. And losing that trust simply is just not an option. So we've already seen cases where AI programs have been discontinued or paused due to real or perceived biases. And to avoid these pitfalls, we absolutely need to build safeguards against bias into the earliest stages of system selection, implementation, testing, and oversight. I know that with AI policies in place across all 50 states, the top priority for the policies must be ensuring the public trust is central to any AI development. And in most cases, this will mean that AI systems will support and not replace human decision making. This is really, keeping the human in the loop, so that as a consultant, as we're advising our clients, we don't want to replace the human. We want to ensure that, AI can certainly flag these issues. They could identify, suggest solutions perhaps, but the human really needs to make that final decision. And yeah, that probably might slow down some processes, but that's ultimately the best way to guarantee that the public is going to be protected from the risks of unchecked automation. So thinking back to how the printing press certainly revolutionized information sharing, and I got to see my grandfather create a scenario where information could be shared broadly, I see that AI is going to continue to revolutionize the public safety industry, enhance its current operations, but open up new possibilities to all of us as we embrace these technologies. And we need to remain vigilant in ensuring the ethical use and maintaining the public trust. Again, thank you for your time.
Thank you, Mr. John. We'll open this up for questions. All right, Chairman Albers.
Thank you, John. Great work that you and Mission Critical Partners do. The swatting hit personally because I got swatted twice last year. So I appreciate you bringing that up. But I think the education is important because in my case, my local 911 center never had that before. So I think that's a really valid point. And I think one of the things I wanted to focus on is we have been talking a lot about recently how 911 systems can automatically answer calls, like you mentioned, in different languages. So immediately to pick up and transition is just extraordinary. And dispatching drones and all that stuff, I think is so exciting because what was a futuristic thing, as we talked about just not so long ago, is becoming reality. But the training part was something that I don't think we're talking about enough. As things are evolving so quickly, you mentioned whether it be, in a firefighting scenario or police or certainly 911, I think that's something that we as a set of committees and we start thinking about what we're going to do. And I chair public safety for the Senate. And as we work constantly to enhance the continuing education credit hours, which you obviously referenced, we are changing the programs of how much training we might do for law enforcement example versus EMT paramedic. I think it's something that we have to embrace more through our Georgia Public Safety Training Center and other areas. And I'm curious, I know that was a lot to get to a question, John, have you seen certain areas of the country, certain municipalities, et cetera, embrace it more than others? And if so, is there someone there that we could talk to?
So I'll say that there have been great advances even before AI with the improvement in training law enforcement officers. There are virtual reality scenarios. I recently toured a law enforcement training facility in my local community, and they have a virtual reality scenario where there are video screens in a circle. They give you a simulated weapon and they run you through different scenarios. I found it interesting that it wasn't about, what was the outcome of the scenario, but it was about the thought process that went into how you reacted with the video screen. And there was a trainer changing the script literally as the script was unfolding and could introduce different pieces and as the scenario was unfolding. And I found it to be interesting because once the scenario was concluded, there was this dialogue back and forth between the experienced trainers and the trainee. And I found that is going to be so important for us. And I can see that going from that virtual reality of, maybe 5 or 10 years ago to an AI-equipped kind of scenario will improve not only the speed, it will improve the quality and making it available to a larger audience where this scenario thing was very expensive to create. You had, technology, you had a physical place. I see that being changing now in an AI virtual type of world that we can expand that access to those training capabilities to greater people without having the upfront investment that we've had in the past.
Great question. Thank you. Brad?
Number 2. Quick question. You're mentioning reports and report generation, and officers' time can spend about 40% of their time writing reports. And the technology can make a pretty big dent into that and enable them to get back on the street and help. But not every police department can necessarily afford this new generation of solution. How do we make sure that across Georgia, our police departments are enabled and armed using AI?
We have seen some states implement AI tools at a statewide level, and that changes the way that again, providing access and funding for those tools. There's a greater advantage in some cases on acquisition costs, being able to spread that acquisition cost across a larger community and provide for volume discounted pricing where you don't have to have each individual agency go out and procure, which is an expensive process, do their own requirements. And it also provides for standardization, oversight, and a greater awareness of how those tools are being used over a greater audience. So I would urge Georgia and other states to look at models where those tools have been implemented in a standardized fashion at a state level, even though there could be an initial cost up front. You provide better access at a lower cost eventually out to all the users within your community.
Thank you, John.
All right, with that, I'll turn it over to Chairman Albers.
Thank you, Chairman Thomas. John, thank you so much for your great presentation today. And again, we'll be doing some contact information follow-up because I know there'll be some more questions as well.
Thank you.
Thank you. All right. And our final presentation today will be our friends at Deloitte. And we've got Gabe and Robin. Are you going to speak as well or just Gabe? Okay. All right. Gabe, come on down. And our very own Robin Crittenden, thank you for bringing Deloitte in. We'll look forward to hearing. I think this is going to be a great way to capstone out everything we heard.
Great. Thank you guys for the opportunity. Just by way of quick introduction, my name is Gabe Grab. I lead Deloitte's AI and analytics practice for state government. So I spend a lot of time with different state organizations, really helping them. How can they use AI? How can they use data to more effectively drive outcomes? So for today, as the slides come up, for today, I'm really going to focus on two topics, two things. One, I'm going to share a little bit around what we're doing from a health standpoint. So most of my use cases are going to be from a Department of Public Health or from a Department of Health setting, but we have a few kind of commercial use cases we're going to share as well with some of the healthcare organizations, some of the health providers we're working with. And then secondly, I'm going to talk about the AI framework that we've put in place with numerous different state organizations to really help them manage AI at scale, to help them prevent and avoid AI risk, to help them put different safety and security safeguards into place. So that's kind of my focus for today. And then, of course, we're going to take some questions at the end. So I don't want to belabor this slide. It's a little bit of an eye test, and I think you've heard most of it already today. But when we look at AI, the way Deloitte looks at AI, we look at it as a spectrum of capabilities. So honestly, I've been doing AI work for almost 20 years now, and certainly I've been doing data analytics work for at least 20 years. Folks didn't call me prior to the emergence of ChatGPT and OpenAI in November of 2022. That's really what has surged the interest in artificial intelligence. Previous to that, we were doing a lot of really impactful, kind of interesting things from an AI standpoint. These things are much lower risk and kind of for us are low-hanging fruit where we can really help our clients make a dent and make a difference. So first and foremost, in the kind of the bottom of the spectrum is robotics and process automation. That really allows us to do things like automatic data entry or automatic generation of alerts. These are very low risk use cases, but can make a huge impact in the amount of time individuals spend inputting manual paper-based documents. As you kind of move up the spectrum, you get a little bit more advanced. So things like optical character recognition, we are actually able to scan an image, scan a document, scan personal information, and load it into a tool. So you're able to seamlessly do that through some of the new AI technology that's out there. As you continue to move up, you get into things like predictive analytics and predictive modeling. We've been delivering predictive analytics and predictive modeling since the early 2000s. So we use it to, predict the likelihood that someone may pay a financial obligation to a health insurer. We use it to predict the likelihood that someone's at risk for a chronic illness or chronic condition. And the list goes on, but these tools and technologies and these ML processes are very mature and have been around for quite a long time. And then you move up to kind of the top or the higher end of the spectrum, which is really what much of the conversation has been around today, is around generative AI. So generative AI, for us, the easiest way to think about it is behind the scenes, it leverages a large language model tool. So the most common one, the most folks are the most familiar with, is ChatGPT, which was created by OpenAI, which was made popular in November 2022. But each of your large technology vendors, Amazon, Google, Microsoft, well, Microsoft is OpenAI, but Microsoft, et cetera, all have their own LLM software. When we implement generative AI for our clients, for our government organizations, we do not implement the public ChatGPTs of the world that you're familiar with. We take some of those model components and put very clear guardrails and guidance in place around the data that's used to train that knowledge repository and the information that's available for both the end user as well as the worker. So as we kind of move through the presentation, to hit a little bit on what do we do from a healthcare standpoint. So we look at kind of the solutions that we deliver across 5 different core modes. The first being document generation. And I heard earlier, how can we more effectively generate documents? What can we do to better send correspondence? How can we use existing documentation to really make smarter, better, faster decisions? The solution that I'm implementing the most right now from a healthcare standpoint is what we call personalized notice correspondence. And we have kind of an abbreviation up here that says healthcare notices and correspondence. And really what it's doing is it's taking those common notices that you get around your healthcare plan has changed, that oftentimes you just throw into the trash, and we're putting a QR code. And the purpose of that QR code is so that you can scan it and you can understand that notice. It'll play a video. It'll let you see it on your smart device. You can, on the fly, translate it into a different language. So if you're the person that opens the language, receives a notice in English, but you speak primarily Spanish, you can on the fly translate this notice. So this is what we're seeing many of our state health organizations move to, because it's really providing that tailored notice, that tailored correspondence to individuals to help them better understand how their healthcare plans are changing, how some of their Medicaid plans may be changing, in a much more seamless fashion. The second one up here, the case and provider management, really is focused more on kind of the worker experience. Oftentimes we call these things worker agents or worker co-pilots, but the most popular one that I'm delivering today in the kind of healthcare realm for states is what we call our social determinants of health repository. And what we do, Deloitte has a large third-party social determinants of health data set that allows us to explore and analyze information around individuals in a given state. So for example, if I want to see at an individual census tract level or at a zip code, what is the prevalence of diabetes? Because I'm doing a wellness campaign and I'm rolling out wellness, I'm able to do that through the third-party data set that we can bring in. If I want to understand, is there a higher prevalence of substance use disorders in a specific area? If I'm trying to roll out a new community health program to a rural setting in Tennessee, I'm able to use this social determinants of health data set to better understand and analyze various different populations based on geographic factors, based on historical health factors, based on received survey information. We're actually now starting to use this SDOH data set even for emergency response. So we have a series of models that are built. So in Tennessee, for the Hurricane Helene response, we were actually able to see individuals that were what we called transportation insecure, meaning that they didn't own a car. So it was difficult for them to evacuate. So we were able to understand that through this third-party data set. As we kind of move down the spectrum, knowledge management. So earlier today, we were talking about training. I know there's a few questions about training. Virtual reality and augmented reality is being used at so much prevalence from many of our client organizations. There is a ton of interest in how can they engage individuals more effectively from a VR standpoint. Yesterday, I was with the University of Pittsburgh Medical College, and we had a team of pathologists that were looking at our VR Engage platform so that they could simulate autopsies. And they were able to put the headset on and in a simulated environment, go through a training mechanism to understand how to more effectively do an autopsy. So that's one very specific example, but we are really seeing VR technology from our market standpoint start to actively take off. And I would say the other kind of precipice or the driver behind that is the VR headsets in the last year have moved leaps and bounds. If you've used a VR set, if you haven't used one in the last year, I encourage you guys to try it out. They are so much better in terms of the interaction. The cost price point has gone from what was $5,000 for a device down to $500 for a device. You don't need the dependence as much on a PC computer. So we're seeing a lot of these technology solutions really enable us to deliver things differently from a business and program standpoint. Back office functions. So back office means a lot of things to a lot of people, but generally to us, we're talking about human resource agents, HR agents, code assistants. Earlier, I heard the question of it's open enrollment season, and like me, I never understand what is changing on my health plan. I don't understand what the other health plans that are there. So we've actually created a health plan assistant that allows you to view your current health plan, allows you to view the other health plans that your company offers, and allows you to ask questions. So will my monthly payments change? What benefits am I losing? Oh, I'm expecting a child this year. which health plan is right for me. And it really lets you do that exploration from an individual standpoint to decide what health plan makes the most sense for you. And then last but certainly not least is the customer and patient area of, better diagnosis, better diagnostics, call centers. So we are seeing a lot of emergence. I know AWS spoke to it earlier from a call center standpoint, where you can use AI to more effectively integrate the data that you may have from a patient standpoint, integrate the data that you may have from a claim standpoint, integrate information from a provider, from a quality standpoint in a much more seamless fashion. So a lot of what we're doing is really putting these public health data platforms into place that better and more effectively connect data. So we are going to try to launch a video as Sydney pulls it up. The background here is this is for TennCare. TennCare manages Medicaid for the state of Tennessee. We built a long-term services and support AI advisor for them. What the tool actually does is it integrates Medicaid policy, LTSS policy, a series of different process flows, and a lot of their published policy information into a single platform that their workers can interact with. So we'll give it 30 seconds, and if we can't get it, we'll just leave it here for you guys. Any luck? No worries. If we can't get it, it's available in the documentation. We'll send it out so everyone can see it. It doesn't look like it. Let's just jump back to the PowerPoint if that's okay. So the solution you were going to see is it's really a interactive chat solution that lets a LTSS worker, oftentimes a nurse, really understand more about policy. And the thing that I was going to point out, and I think that's the most interesting, is a lot of things what we talked about today circle around data transparency. How can we trust what is the outcome? What is the answer? What is the solution? So in the tools that we build, we actually will cite the specific policy document where the information came from. It'll actually even give you a determination. It will tell you how did it determine the answer that it responded to. And as a user, you can vote to, provide a thumbs up, a thumbs down, and a comment. So you can give us feedback if this was helpful or not. And when we continue to maintain these solutions, we use that feedback. We use that thumbs up, thumbs down mechanism to really continue to enhance and improve on these solutions. Sydney, I lost the ability to click. You mind advancing to the next one? Well, in the interest of time, I'll keep talking. So Deloitte has an AI Institute. And as part of that AI Institute, we really focus on going out into the market and understanding feedback from the various different organizations we serve. So this survey result is just one of many survey results we've seen from an AI standpoint, but it's really focused on, do organizations think they are prepared for AI? So we went out to 3,000 different executives, both from a technology standpoint and from a program standpoint, across 5 different industries in North America. And what we found is less than 50% think they're highly prepared for AI. And I know that's a little subjective of what does highly prepared actually mean. But I think the important takeaway, and the reason I included this in here, is that, and the way to read the graph is that the larger circles mean that they're more prepared, more comfortable. The smaller circles are where they have the most challenges or the most concerns for being AI ready. So risk and governance is one of the top areas that organizations feel they need or are unprepared for, feel they need more guidance. The other piece is around talent, and talent does include a training function, talent includes a learning function, but those are the 2 big things that we're seeing from an AI preparation standpoint. Surprisingly, organizations felt much better about data management and technology infrastructure. I thought those would be a little bit lower, but this is what the data results are actually showing to us. So why is that important and why did I show it to you guys? And I know these slides are a little bit of an eye test, but we've put together an integrated approach, what we call our readiness management framework or AI ready framework. And really what the intent at the 1,000-foot level is to help organizations come up with, focused guidance on how do you get ready for AI? How do you manage your AI solution? So first and foremost is around setting the direction. So it's understanding what is the business impact, what is the business use case that you're going to deliver. It's defining a risk framework and a management framework for how you're going to actually govern your AI solution. It's establishing your governance standards for how are you going to, integrate the data? What data are you getting from? Who's responsible for training and tuning the model? Who's responsible for ongoing maintenance? So it really starts with setting the AI direction. The second component is really around building core capabilities. So how do we, train or go and hire individuals that have the requisite knowledge from an AI perspective? How do we make sure our data is of quality? So data is a foundational component that drives AI success. Bad data in will lead to bad data results. Do we have the right technology platform in place? So these technologies oftentimes are not cheap, especially if you're using a OpenAI type tool where they're charging you from a token-based model. So every time you interact, you are paying a fee. So how do you make sure that you set the right payment structure in place? And do you deploy this to your infrastructure or do you use a cloud-enabled infrastructure? And how do you make sure you have the right security standards in place? And then last but certainly not least is how do you manage AI? How do you manage it at scale? Who is responsible for tuning your model? Who is responsible for the ethic of your model? Who is responsible really for the ongoing maintenance? And then the wraparound services, and the last slide that I'll end with, is really around trust. So as you kind of start driving down more into this AI framework, there's detailed accelerators and tool sets that are available to help you manage your data in a more trustworthy fashion. So these are the 6 different core components, but to kind of share a real story is that we built a solution that predicted the likelihood of an individual to pay their financial obligation. And, we looked at everything from an ethics standpoint for how do we control the data from a socioeconomic standpoint, from a demographic standpoint. We looked at 200 factors. And when we went to roll the model out, one of the things that we found is that the model was disproportionately weighting an individual as unlikely to pay if they didn't have a bank account. So had we not had this framework in place, had we not had the right tooling in place, we would have never found that. And what the actual data showed is when we looked at individuals that didn't have a bank account, it had very little impact, very little influence on their actual likelihood to pay. So the reason we put this in place are for situations like that really allow us to catch some of the individual model flaws and allow us to do a little bit more kind of advanced training. So with that, I'm going to pause. I know it's pretty quick, but happy to take any questions folks may have.
Yes, thank you, Gabe. Excellent presentation. I'm going to start out with Senator Setzler.
Thanks for being here today. I thinking about democratizing AI. If I had a constituent back in my district that came to me, a small business owner, and said, I see you're on the AI study committee. You must have heard some presentations on this. I've got a company with 7 employees, and I want to use AI in a meaningful way. If it was a company with 700 employees, maybe 70, they could go to Deloitte and you would give them a concierge service and you give them great consultancy and you'd sort of help them analyze which different softwares. In plain speak, if a 7-person company wants to, and I don't mean people who are who are savvy people, but they're not tech developers.
Yeah.
Say, I want to use a large learning model or one of these AI tools I want to understand it, and then I want to find a really innovative way to deploy it.
Mm-hmm.
What's the Microsoft PowerPoint out there of AI? Is there a software system? I mean, if people came to me and they said they wanted to do great design, I'd send them to, you go to the Adobe Creative Suite, you pay $79 a month and you can do anything you need to do creatively.
Yeah.
What's the democratized AI platform you can go to? You could see a very clear fee model and start using it.
Yeah. So It's a great question. It's probably, there's not a simple answer to it, but I would say from my perspective, if you are a small organization and you're looking just to kind of dip your toes into AI, and your business case, let's say, for example, is you want to enable your employees to, build better PowerPoints, generate information more quickly, be able to search the web in a secure fashion.
Well, you want to be able to, you want to turn AI loose on a client sector data sets out there that I can't even aggregate. I want to unleash AI to go find stuff that I can't find for myself, aggregate it, make some sense out of it, and come back and tell me stuff I can't learn
Yeah.
just by surfing the web, whatever.
Sure. So there are some low cost options for you. Microsoft Copilot might be one of the ones that you would consider.
Okay.
And the reason I like Microsoft Copilot is it's built directly within Microsoft Office. So if you use Microsoft Teams or you use Microsoft Word or Excel, enabled directly within the toolset itself is you can actually use ChatGPT and answer a question.
Okay.
The thing that you need to be aware of and understand is that the data that you're providing into it is going to a public data platform, right? So you are not continuing to own and control everything in this small organization, which may be fine for certain things. And you can restrict things. So there's something that is a very cheap kind of practical thing to do is to put an AI sensor on top of some of these AI solutions it detects for things like social security numbers or private information being input into a ChatGPT-like interface. And you can do that. Those are thousands of dollars, not tens and hundreds of thousands of dollars. The other thing you can do, because I know pricing and price is a concern, is most of the large vendors, whether it's Google, AWS, Microsoft, etc., they actually will provide you a financial dashboard. So you can actually see how many tokens are you utilizing, how much is this costing you. The other thing that we do with a lot of our clients, and I would be frank, we don't really work with organizations where there's 7 to 10 people very often. But what we do is we set up a sandbox environment and we prove out the solution for them first, and then we project what the long-term costs will be. The long-term cost will, like an example, is we implemented a chatbot solution. We call it a generative chat solution that's available on the web for an individual state and allows you to ask more information about your clearance process. We had 30,000 people use that chatbot in week 1, and the cost ended up being, it was close to $15,000 a month. So, which was just not fathomable. It was just not what they were looking for. So what we actually then did is we actually took the chat that we were getting and we actually put it into our standard chat, the response. So we actually provided a standard response with generated results. So now you only go out to the large language model, you only go out to the AI if it's not already a known response in the knowledge repository.
So the business model is, like I said, it's tokenized. For every interaction, that's how they pay. There's no sense in which I can get a subscription based. I'm gonna buy a thing, I'm gonna give a lump sum fee, and if I'm enterprising, I can have lots of hits and lots of nodes, but I've paid the subscription. mine's gonna be very active. Is there a model for sort of subscription service, or is it all based on number of?
The subscription model is typically the token model. That's what they would consider a subscription model. But there is a model where you as a state or you as an organization can deploy your own AI solution. You don't need to rely on going out to a Microsoft if you don't want to. So you can take free software, like for instance, Meta. You can take Llama 2, which is a really common large language model. You can deploy it on your own infrastructure and you can start using it. The thing that you need to be cognizant of is you need to scale the infrastructure. So there's a technology cost for you as the individual. So it's really just a comparison of, is it worthwhile to deploy into my own infrastructure, or is it more cost effective to go out to a cloud infrastructure? And if you would ask me that question a year ago, I would deploy it yourself. You manage your own infrastructure, especially if you have an IT shop. Now the cloud costs are coming way down where it's almost more cost efficient to go out to the cloud.
Very good. Other questions? Fred?
Dr. Erskine earlier was mentioning the responsible use of AI committee at Emory. And if you have an organization that does not have a responsible use of AI committee in place, what would you recommend as the first steps to make sure that they have that set up and enabled?
Yeah, so we actually build AI governance structures for a lot of different state government organizations. And oftentimes what we'll start with is comparison of what other states have done. So we'll bring to them, hey, here's states that are similar to you, similar to your goals, similar to your objectives, that have put a pretty robust governance structure in place. Secondly, is we'll bring in our Ready AI framework that actually walks through the key components of everything you should consider from an AI trust standpoint, from training your data, from an AI ethics standpoint. And then the other thing that we do is we pull together what we call a risk framework. So to me, one of the most critical points is when you are establishing what is the AI solution or AI use case that I'm going to build, I'm going to implement. You need to do that risk framework up front to understand what is the potential downstream impacts, to understand the technology, to understand how I'm going to build the model, to understand how I'm going to maintain the model. Sometimes organizations have a tendency to just jump in and deliver. So this really allows them to put a governance process in place to understand what is the potential impact. So that's normally what we're doing.
Thank you.
Other questions? Seeing none, Gabe, thank you for that excellent presentation. We have heard so much good content today. I think we could have spent about 18 more hours doing this. I know time was a little tight. I want to thank again our speakers for coming today. Right after this, we are going to have a lunch for all of our speakers, our committee members, and working committee members. So hopefully that will allow some more questions and answers to take place. And that's going to be when you walk out of the doors of this committee room, go down the stairs to the left, and it is that first landing, the room right there, which is called the Senate Mezzanine. I failed to mention earlier, we're going to do a virtual meeting, committee members, on the 25th of November. That's Monday, the week of Thanksgiving at 2 o'clock. It's going to be a Microsoft Teams or Zoom meeting. And the purpose for that is going through a little more of our recommendations. Again, I mentioned earlier how critical it is that you start sending your stuff to Haley now so she can continue to build that. And Haley, probably a good idea to post a working document somewhere everybody can share it so they can see it. But I'd like her to make the edits if you don't mind, just to keep things with a little bit of continuity. Our last meeting for the Senate specifically, again, as a whole body, will be here at the Capitol building on December the 3rd at 10 a.m. It'll be the time that we'll be adopting that report. So a lot of work happens between now and December 3rd. From that, let me turn it over some final comments from Chairman Thomas.
Thank you, Chairman Albers. As we talked about earlier, this is going to be the last joint committee that we're going to have. I'd like to really give some special recognition to the Senate team and all y'all's hard work. Will Spencer, you have gone above and beyond. If you're ever looking for a promotion and want to move to the House, let me know.
Objection.
Yeah. Last chance to slide that in. Otherwise, we've come a long way when we started this journey, well, I guess well over a year ago, and look forward to continuing. We've got more educated, and that was the whole point of this committee, and look forward to what we put forth in this coming session.
Thank you, Chairman Thomas. Again, I want to thank everybody for their hard work. As I was mentioning earlier, I was quoting Winston Churchill. This is not the end. It's not the beginning of the end. It's the end of the beginning. And this is going to go on long past what we produce in a report in December and long past what we work on in a legislative session. We need to continue to hear from you. The wisdom that you all have imparted on us today is extraordinary. We need these committee members to stay active even as study committees and subcommittees end to get reconstituted. We're going to need all your help. We're going to need help from our industry folks, all the folks that represent different areas in government affairs who have been a critical partner, have been of extreme help as well. So with that in mind, we're going to call this meeting hereby adjourned. Have a wonderful day and afternoon.